good afternoon. I'm glad to be here. I think that Benito just gave us a bigger framework or the bigger landscape, and I will begin now. We will try to insert autism in this bigger landscape. So the title of my work is Brazilian Public Policies for Autism Spectrum Disorders between Mental Health and Disabilities. I think that Benito just gave us some clues about this tension between mental health and disabilities in Brazil. It's a work that I decided to include a co-author because it was a master's student that just finished his work on this theme, and the second part of my presentation was made especially by him, Bruno, Diniz, Oliveira. He's not here, but he is here. As Daniel has told us, initially the psychiatric reform movement and the CAPS have prioritized adult patients, especially those coming from extended psychiatric hospitalizations or those in their first crisis, so to avoid their visits in psychiatric hospitals. But autism didn't fit into any of these criteria, and as a result was not included in the psychiatric reforms agenda until the end of the 20th century. So I will begin talking about the mental health field, and in the second part about the disability, the health of disabled people. So, in fact, it was not until the turn of the 21st century that autism became visible as a public health and social concern in Brazil. During this period, two simultaneous moves have occurred. One, the inclusion of children, and like in Australia, about Australia, the inclusion of children into the focus of Brazilian mental health policies, and the expansion of public policies aimed at people with disabilities, both having a direct impact on autism. So let's talk about mental health. So between the first and second decades of this century, well, now, autism became more prominent in the mental health field due to a greater emphasis on child mental health in public policies. Benilton told us about the CAPS. We have also the CAPC, the Psychosocial Services Centers for Children and Adolescents, have been strategic devices for this purpose, working together closely with other sectors such as education, social welfare, legal and advocacy sectors, etc. Such services tend to be located in medium and large cities. This is an example. Generally, they are located in houses. This is an example from Uberlândia in the state of Minas Gerais. And this is an example of São Paulo. Such services tend to be located in medium and large cities, and at least in some regions of the country, they care for a significant number of autistic individuals, but not in the whole country. I will show some numbers about it. But there are still too few CAPC, and some of them are struggling with structural precariousness regarding the upkeep of the facilities, the size and number of attendance rooms, the lack of things like telephones, transport, even medicines, a high turnover in staff, etc. And so the numbers, Benilton just showed us this total number of CAPs. Nowadays, 334 CAPs, but the number of CAPs is quite smaller. It's 32 in 2002, and now in 2016 is just 2010 in the 210. Sorry, 2010. It was my dream. My fantasy. 210 CAPs to children and adolescents in the whole countries to view. A survey carried out in 2011 in 14 CAPC of Rio de Janeiro's metropolitan area, it was made by my team, showed that 35% of the patients using these services were diagnosed with autism. was the main group. Some data is in Portuguese, but now it's the 35%. Most of them between 10 to 19 years old. Most of them, according to the international literature, the relation between gender is the same as in the international literature. 80% were male. Most of them, most of them lived here. Most of them lived with their family. A minority lived inside the asylums. Most of them lived nearby the CAPC, and 20% was out of school in 2011. 56% was taking medicines. It's the main, most important data. Here we can return.
There's another one.
Another one? What?
Those who are exclusively independent as
Oh yeah, most of them. We had a lack of data here. It's important, but most of them are exclusively treating themselves in CAPC, and 17% they had another kind of treatment simultaneously outside, especially speech and language therapy, phonology, and sometimes neurology.
Rossano, before the first one, what means intensive and semi-intensive?
Yeah, it's the number of times that these people goes to the CAP. So most of them are going just 1 or 2 times a week. We didn't research the time they spend there. Most of them, well, now here is the number of CAPC. Most of them they have treatment to individual and collective group of treatment to the autistics. Most of them gave some kind of hearing or treatment to the parents also. Well, okay.
The parents together with the kids or the parents alone? When they say care to the parents?
No, this is 13 offers treatment, individual treatment to the autists. 13 CAPC. 13 CAPC offers collective or group spaces for treatment for the kids, and 12 offer spaces individually or group therapy or group a kind of group therapy to parents.
Only parents, not parents with kids?
No, none. I think none have this kind of work together.
Don't have meetings, Assembleia de
Yeah, no, but he's asking if there are spaces that mix kids with their parents. No. None of them made a kind of assembly of autists, but it's difficult to imagine this kind of space. And most of them make some house attendances, home attendances. Well, so now the disability field. And at the end I will return to talk about both. The health status of disabled people was also in the spotlight in the beginning of the 21st century, as reflected in the policies relevant to people with autism spectrum disorders. The ratification by the Brazilian government in 2009 of the Convention on the Rights of People with Disabilities, enacted by the UN in 2007, has inspired the development of the Living Without Limits plan. It's a picture of the cover of a book of this plan, which included autism. Now with the, it's a little joke, with the new Coopist. There's this word, coopist. the new golpist. Coop. What's a golpist? The new right wing. The new right wing government. It will be not the plan living without living plan, but will be living without plan. Just that. This plan encompasses 15 federal agencies and coordinates actions focused on people with disabilities in the areas of health, education, accessibility, and social inclusion. As part of this plan, the healthcare of people with disabilities network was created within SUS, the Brazilian Unified System. In fact, this plan is still, well, most part of it is still in the paper and not in reality. Something about disabilities. According to the last Brazilian census, the statistical agency, the statistical Brazilian agency, 45 million people declared that they have some type of disability in Brazil. More or less 23%. Most of them different kinds of visual disabilities, light disabilities. 7% disabilities or motor disabilities, 5% hearing deficiency, and 1.44% mental or intellectual disability. In the scope of the Living Without Limits plan, 2 initiatives gained strength. One of them is a national piece of legislation initiated by family members which resulted in a law, this law that's called Autism Act or Diniz Act, in honor of a family member, Diniz, who first worked to submit the bill, and she lives in a city nearby Itaboraí, in the state of Rio de Janeiro. This is the law, but the main point, it's in Portuguese, but the main point is that from the law on, for legal purposes, people with ASD, autism spectrum disorders, were officially designated as people with disabilities, being extended the same rights given to the latter by other pre-existing Brazilian laws. Another initiative that had important developments was the ABRAS. ABRAS is the Brazilian Association of Autism, the hugest one. The ABRAS mandates to the Ministry of Health requiring the development of a protocol that regulated the health assistance to people with autism in Brazil. At the end of 2011, a working group dedicated to this subject was formed. I was part of this group. The group included the Minister's Office of Mental Health and of Disabled People's Health, so it was they tried to work together. Professionals and managers of the public health systems, professors and university researchers, and representatives of family association. But after a few meetings, however, internal disagreements is, as Benilton told us, related to power, caused a division into 2 groups. One coordinated by the mental health and another coordinated by the health of disabled people office. Such segregation expresses the tension and disagreements existed between these 2 areas in Brazil and resulted in 2 separate documents published simultaneously by the same ministry with health policies destined to the same audience, people with autism. And so this is one document, is the document from the health of disabled people, the rehabilitation field, as guidelines for the rehabilitation of the person, of the people with autism spectrum disorders, and this one from the mental health field, that's more or less care of people with autism spectrum disorders and their families in the psychosocial attention network of the unified health system. But the 2 documents have some similarities. They included the participation of ABRAS, the Association of Parents of Autists, the ABRAS representatives in their drafting, both highlighting intersector work the protection of rights and interdisciplinary team, and valuing the role played by the relatives throughout the treatment. And they also agree that the purpose of the assistance is to promote autonomy, to improve social skills of the kids, inclusion in the job market for adults, and in community life. But there are some differences. The rehabilitation guidelines are closer to ABRA's initial charge, prioritizing indicators and screening instruments for identification of developmental delays, in addition to suggesting habilitation and rehabilitation strategies in the health network for disabled people. The mental health documents, although also presenting criteria for early identification of risks for developing autism spectrum disorders, this document emphasizes the organization of the psychosocial support network, in addition to including a chapter about interprofessional practice within education, social support, and policies for people with disability. And another difference is that the mental health document was submitted to a public online hearing, and a preliminary version was made available on the internet at the end of 2012, receiving comments, suggestions, and contributions from professional and lay people individually and institutionally. And lots of these suggestions were really included in the final draft, because I took part of this whole process. So after they are trying to put these two fields to talk, and so after discussions within the Ministry of Health, especially within the field of mental health, the National Advisory Committee for Improvement of the Healthcare of People with Autism Spectrum Disorder was instituted by a ministry ordinance in May 2013. What is this committee? This committee meets once or twice a year, composed by members of the Ministry of Health and by the authors of both documents, in addition to invited participants such as the Psychoanalysis, Autism, and Public Health Movement, and the Brazilian Association for Rights of People with Autism, with the purpose of coordinating actions between mental health and rehabilitation. Problems with this relation. Among professionals of the mental health sector, Benito has told us about it, it is common to hear criticism about the conception of autism as a disability, since such idea is historically tainted by negative values associated to the exclusion of children considered retarded, who were predominantly poor and black, in public or philanthropic shelters or even psychiatric hospitals throughout the 20th century. The scarce interaction between mental health policies and disability rights movement has led psychiatrists, psychologists, and other mental health workers to associate the idea of disability to the medical model, almost virtually ignoring the social model. Just very recently, some psychoanalysts began to write about the social model and medical model and trying to relate their theory with the social model, but it's too recent. And this issue is corroborated by a language barrier. In the Portuguese language, there is no correspondent to the term disability. The word desabilidade has been proposed, included by some of us, but it consists of a neologism with no current use. The term deficiência is currently used to translate both disability and deficiency. Well, to come to the end, the Brazilian context about autism is also characterized by a strong presence of psychoanalysis. Representing one of the pillars of the Brazilian psychiatric reform, along with the Italian democratic psychiatry, the psychoanalytic tradition is even stronger in child and youth mental health services. It's another work that was published, a focus group-based research published by Lima et al., showed that professionals of Rio de Janeiro's CAPC tended to defend the importance of a minimum theoretical line, and that psychoanalysis was the most quoted theoretical framework. Although some praise it for the diversity of lines, some criticizes the theoretical stiffening of some services, and some of them claiming to base their practice more on their own experience and their own insights. So, the final comments. I think that now, what's the future? The future is uncertain in both sides. The last Dilma Rousseff, Ministry of Health, nominated a mental health coordinator that had been director of a huge private asylum. So, a huge movement against him was created in the whole country. He's not there anymore, but there's nobody there. And the provisory right-wing Temer's government closed the Ministry of Human Rights and transferred the Secretary of Rights of People with Disabilities to the Ministry of Justice, and some of the militants of this field think that it's a disempowerment strategy. Thank you, that's all.